Hi, my name is Brad Heineck. I'm a physical therapist.
And I'm Bob Schrupp, and I'm also a physical therapist. In this section, what we're going to talk about is the TENS unit and where you might want to use it and how, well not how, but when you may want to use it. Again, TENS is transcutaneous electrical nerve stimulation. Brad, you just want to show the unit here, what it looks like.
This is a MP TENS unit. The MP is the name of the company that sells these. And this is what they look like. They're small like this, and they're actually getting smaller all the time as everything is in the electronic field. But this is it. You have your wires that connect up to the electrodes that we have here, and we'll demonstrate how this works in just a few minutes.
Okay, so again, when might you use a TENS unit? One would be, I tend to use it as a treatment of last resort. I try other things first because I'm trying to actually cure the pain or get the pain to go away permanently. But if you're finding out that that's just not happening or it's taking a long time, that's where I think TENS comes into play, especially for like chronic pain.
Right.
And I'm just going to kind of go down the list. Rheumatoid arthritis, osteoarthritis, a lot of times those things are not going to get better unless you have surgery and actually replace a joint. So those come in handy. Back pain's a big one. I have probably more patients that I've used it for back pain than anything who've had chronic back pain. And they've had relief. I mean, there's people that they wear it, a lot of people I have, they wear it all day long.
Right, right.
They used to use it for labor pain. I don't know if they still do. I don't know enough about that. Peripheral nerve injuries, that's a good one.
Peripheral nerves being...
Oh, yeah, good. Explain what peripheral nerves are.
They're the nerves in the periphery, you know, the ones in your arms or your legs,
the extremities.
Away from the spine, typically extremities, arms and legs, yes.
Trigeminal neuralgia, that's actually a neuralgia that happens in your face. This is a good one, phantom limb pain. A lot of people get pain after they've had an amputation of some sorts, and they're actually having pain where the limb used to be, and the TENS unit can help decrease that pain. Right. Sports injuries, sciatic nerve pain, that's pain that's going all the way down your leg from your back, all the way often into your foot. Aching joints, post-operative pain. We were just talking about this before we started here, that we know that they still do implant electrodes sometimes operatively, and then they have the device is externally located, but to help decrease pain for people who had surgery, especially for people with chronic pain.
Right.
So,
I think one thing I want to emphasize is typically when we get referrals from a physician for a TENS unit, it's someone who's had pain for not just a few weeks but months or even years. They've already worked with other options, particularly pharmaceuticals. The pain pills are becoming not effective anymore, as well as the side effects of possible damage to your organs from your stomach to your intestine or whatever from side effects of long-term use of pain pills. So it's time to eliminate that. That's a great thing, was to use the TENS unit at that time too.
That's actually a really good point, Brad, because actually to qualify, I know like under Medicare, to even qualify to purchase TENS unit, and Medicare will often pay for a good portion of it, is you have to meet those qualifications. You have to have had pain for quite a long time. I don't know what the exact thing, I think like 6 months. And it's got to be in a specific area. So absolutely, that's where it is often the indicator. Muscle pain, and then the last thing we got here is whiplash and neck injuries. Again, that's the chronic pain situation where the pain's just not going away. I think, you know, sometimes where the TENS unit actually probably could help, quote, you know, cure a situation is, let's say you're kind of caught up in a pain cycle where, you know, your body splints and spasms in reaction to the pain, and then it just can't get out of that. This might calm it down enough that it can start to heal. You know, there's no blood flow into an area when it's tightened up, and so it can get in that painful cycle of not getting any better.
Yeah, using this to get those muscles to finally relax, get the blood flow, and get out of that cycle.
Okay, so that's the things we are going to use it for. We also got to go over the precautions, which we'll go over in the next section.